Hi, this is Paul Sackis, Good News Planet, speaking to Gene Sachs. Hi, Gene. How are you?
I'm good.
You're the CEO of Living Beyond Breast Cancer, and we're going to talk about new social media campaign that raises awareness of metastatic breast cancer and how you can get involved. And actually, Breast Cancer Awareness Day is October 13th. Am I saying that right? Metastatic?
Yeah, it's one of those words a lot of people trip on. So yes, it's metastatic breast cancer, and October 13th has been designated for the 5th year in a row Metastatic Breast Cancer Awareness Day.
So what is metastatic breast cancer?
So metastatic breast cancer is cancer that has spread beyond the breast, so it's no longer considered early stage. When breast cancer spreads, it likes to go to the lymph nodes and then often to vital organs, maybe the liver, the lungs, sometimes the brain, and often the bones. So once cancer is out of the breast, it is no longer considered curable, which means women will be in treatment for the rest of their lives. The good news is many women have cancers that are very responsive to treatment. So even though they have to continue to be in treatment, they're actually living quite well. And living full lives, and kind of freezing the cancer in its tracks.
And so tell us about your organization. How are you assisting with Living Beyond Breast Cancer?
Sure. So Living Beyond Breast Cancer is a national nonprofit. You can learn more about us at our website, which is lbbc.org. We are all about connecting people impacted by breast cancer with trusted information and a community of support. So from the moment you're diagnosed or you find out someone is diagnosed, you can come to our website. There's a lot of resources. We have webinars, physical conferences. We have a toll-free helpline that is answered completely by volunteers who themselves have been diagnosed. So it's peer-to-peer support. So we have women who have been diagnosed all stages, all ages. We have a lot of informational brochures. So we're a deep resource. There's a lot of information about breast cancer out there, but how good is it is the question. So we really make sure our information is vetted by doctors and try to deliver it in a way that women can understand it.
What is that 800 number? 800 number, is it?
Well, our helpline number is an 800 number, which is 888-753-5222.
888-753.
5222.
Okay. Okay, helpline. All right. And so, did you say that's 24/7?
It's not 24/7, but we answer it live 9 to 9, 5 days a week, Monday through Friday. So it's not a hotline. It's not for crisis, but it's a place to go if you want peer support. And many times it's caregivers that call. So whether it's partners or friends or family or daughters or sons who have questions. So anyone can call who wants some information.
Well, since you've been involved with this, I think since 1996, okay, so it's some time, right?
Yeah.
Give us an example of how you've helped somebody in this, difficult time.
Well, there's lots of ways Living Beyond Breast Cancer helps. I think the most important way we can help is when you're diagnosed with breast cancer, a lot of information is thrown at you really, really quickly. You go to the doctor, you get this diagnosis, and suddenly all these new terms, and you have to make decisions, and it's overwhelming. And we're a place that you can turn to. We can sort of help synthesize the information, help you identify the questions you want to go back and ask your healthcare provider, make you feel more empowered when you're really freaking out, and get to the next step. And that's what I think we do really, really well. And then as you're living with the disease, we bring together top experts from around the country to speak at our conferences and speak at our webinars. We do Twitter chats, and it's just a way to sort of check in and make sure, are you getting the best care, or do you need to go back to your doctor and ask some new questions?
So at this stage, is this beyond radiation and some of those kinds of therapies?
Yes. When you have metastatic disease, radiation you wouldn't be doing, but chemotherapy is something many women will continue to do. Some women take hormonal therapy. It really depends on their specific diagnosis. Probably not surgery, but sometimes they do some surgery. It just really depends.
Okay. What is mybcstory.com? What is
yes.
that?
So mymbcstory.com is a website which is specifically about metastatic breast cancer stories. So if you go on the site, there's a lot of information about the disease. We have areas called mind, body, spirit, because we do believe health is very holistic. And there's an interactive component. So you can go on there. We sort of have this garden. You can plant a flower, which basically means a woman with metastatic can go on there and set up her profile, and then friends and family can come on and support. I think there's over 600 flowers in the garden right now, and I think that's great because when you're diagnosed with metastatic, you're pretty isolated, and it's good to go to a place where you can see there's others in a similar situation.
And the social media campaign, tell us about that.
Yeah, hashtag NBC Strength, and that'll be active all month, the whole month of October.
And what will somebody do when they get there?
Well, that's the Twitter account. There'll be lots of information coming out about both the NBC Story site as well as metastatic breast cancer.
Is this how a listener can get involved to go to these two different locations?
They can, and they can also go to the organization's website, which is lbbc.org.
So when somebody, comes to this phase in this cancer, situation, what are your people like on the phone, and what is the organization saying? How do we deal with this as a family?
Yeah, I think we try to be very positive. First thing we want is for women to really understand their specific diagnosis and what treatments are open for them, and what are the side effects and how much of their regular life can they maintain, which we hope will be much of it. So we want people to understand that. We want to make sure they're getting good care. Do they like their doctor? Do they want a second opinion? Is this the time to check in and see that is there someone else out there? Is there a clinical trial that might be right for them? So we really want them to be educated, informed, and then we want them to make their decision, because this is a very personal decision. People have to make with their family and figure out how they want to move forward with treatment.
Any suggestion on how a man handles something like this?
As a supporter,
with the relationship, and let's use in the family as a wife. Your wife is going through this. What do you suggest for a man to do?
So in a perfect world, be very supportive. It's horrible to go to these appointments by yourself. So I think always having someone with you makes a huge difference, both as another person to listen and take notes, but just be there for support, to understand that this is a long road. Sometimes your partner may feel well, other times she may not, to be patient. And when she is feeling well, to really try to do as much as you can, and then to be understanding in those times where it's more challenging. And psychologically, it takes a huge toll. It's not easy to live. We all don't know when we're going to die, right? We don't know. But to know that you have an illness that is incurable is a lot to manage psychologically.
So I would imagine so. Well, let me ask then, first, is there anything else you'd like to share with us?
No, just to make sure people know those websites, mybreastcancerstory.com, and livingbeyondbreastcancer.org.
And I see this interview is provided and supported by AstraZeneca, who's a very honorable and socially minded corporation. That's good news of and to itself. They've
certainly been at the front line of, helping and supporting women with breast cancer for a very long time.
Right. Now, with these kinds of companies sharing the message and working on the medicines to help us all live longer. That's their motto, and that's their desire. So it's all good. So last question, what's good news for you, Jean?
For me, what's good news for me with breast cancer is that I think it's great that we're starting to spread the word about metastatic breast cancer, because I think it's so important that people understand the difference. And I think there's been a lot about early detection and women running in races and a lot of pink, but let's really understand what it's like for those 152,000 women that are out there.
Is that an annual concern, or is that women living with it as of now?
We don't know exactly how many women are living with metastatic because the cancer registries don't actually count once they've turned metastatic. That's something we'd like to change, but that's what our estimates are, that anywhere between 150 to 250,000 women.
Okay. Jean, thanks so much for sharing this with us and our audience. This is Breast Cancer Month, right? October as well.
It is.
And so this is the time and to get the word out and a great opportunity. That number again is first we have the sites and the hashtags and the number again was 888-753-5222. Is that right?
That's great. Good for you.
Okay. Now we
Good
also
memory.
No. I wrote it down, and it's on yours on the details that we will provide to the audience as well. So thank you so much for sharing good news with us, Jean.
Okay.
Take care. Bye-bye.